Now, from a planning perspective, the shift to individual coverage can actually be helpful because each spouse has their own plan, their own premiums, their own structure. And so again, from the wife's perspective, that can create more clarity, control if she ever needs to manage this whole process on her own. Welcome to another episode of the Simply Retirement Podcast, where we want to educate and empower women to live your retirement on your terms. I'm your host, Eric Blake, practicing retirement planner for over 25 years, founder of Blake Wealth Management, and I would not be the man I am today without the women in my life. Joining me again is Wendy McConnell. Wendy, how are you?
I'm great. How are you?
I'm doing very well, very well. I know as we're recording this, you're about to take a little bit of time off, so we won't be together for a couple of weeks. So it's I know you're excited.
Well, I'm excited for the time off and going away, not to be away from you.
Yeah, I appreciate you clarifying that. It's probably better that you do than I do, right?
Yeah, especially since I was just telling you how I see all of these our past videos, and we're laughing in all of them, so we have a good time together.
It's a good thing. Good thing.
Yes.
So I want to hop right into our episode because I think I have come up with a topic that you might actually despise more than taxes. What do you think?
If it takes away more money than taxes do, then yes.
It could. And actually, that could be a true statement right there. So today I wanted to spend some time talking about health insurance.
Ugh.
Specifically spouse health insurance and how that fits into the bigger picture of retirement planning. Because this is again another one of those topics. I get a lot of my topics for the podcast from conversations that we have with clients. And especially if we've had a similar conversation over a short period of time. And that's where this one's coming from, is directly from recent conversations we've been having. And even though the focus of this podcast and a lot of what we do, a lot of what we talk about is focused on educating women, many of the families we work with are couples. But what's something very important to me is that both spouses are actively involved in the planning process. And in just the last few months, we've had this conversation multiple times where the husband's retiring as the primary earner, and the wife has either already stepped away from work, has been out of the workforce for some period of time. Different reasons for that. In one situations for providing care for her parents, things like that. But as the husband retires, one or both of them may not be eligible for Medicare yet, right? And in one case, it's the husband, so he's already eligible. He just recently retired. He was eligible at the time, but his wife wasn't. And in the other couple of cases, the husband is going to be eligible for in just the next year or so for Medicare, but the wife is still going to be a few years away.
Okay.
And that leads us to one of the most common questions we hear, especially when people are going to be retiring before 65, is what do we do about healthcare? And that's exactly what I'm going to walk through today. And what I hope we want to give you a clear understanding. We're not going to have all the answers for you. It's really going to be based on your individual situation. But again, back to what I always talk about is a process for identifying your options and filtering through what's going to make the most sense in your specific situation. And one of the things that I always stress is that even when we work with couples, I am always going to be looking at these decisions from the wife's perspective. Not just what might work today for both, but what happens if something changes tomorrow.
Okay, I like that.
So basically, what if something happens to the husband, what does that decision look like for the wife on her own? Because I've shared a story about a client we had, it's been a couple of years ago that she's been working with us, where he retired, started Social Security, passed away within just a matter of weeks after that. And she was basically on her own, she was actually under age 60 at the time, and she was really in a tough spot. And it was just a matter of helping her identify what her resources are and putting a plan together so that she could say, it would not just live, but actually a big part of that is health insurance. What is she going to do about health insurance, especially at the age she was at the time? And so again, just about connecting some of these dots. But when we're looking at it from the wife's perspective, it's would it still be manageable? Would it still make sense for her if it was just her? Or would it create unnecessary stress or complexity in her financial life? Because that's often where the real risks are going to show up. As a free resource also for today's conversation, we've got a simple checklist, which is referred to as Will Healthcare Change as I Transition into Retirement? And it's basically just designed to help you think through the exact decisions we're going to be discussing today so you can better understand what may apply to your situation and what questions, that's always a big point, what questions should be asking. What are the right questions to ask when we're talking about especially healthcare? And you'll find a link to that resource in the show notes of this episode, where you can go to the simplyretirementpodcast.com.
Sounds good.
All right. So one of the biggest challenges with healthcare planning retirement is that it's not always just one decision. It can often be two separate decisions happening at the same time. So as I talked about before, where you may have one spouse moving on to Medicare while the other is still trying to figure out how to bridge the gap until they get to Medicare.
Okay.
You may have both spouses under age 65 where you're trying to replace employer coverage entirely. And that's really where it becomes important, because in many cases, you may be the one coordinating the decisions, but at some point, if it's just you and you're managing that on your own, that becomes, again, a much tougher conversation. And healthcare is often, we know that healthcare is going to be one of the largest expenses in retirement. And it's also one of the least understood as well.
It's not just in retirement anymore.
Right. Well, and we're going to touch on that as well, because I know that's one of the things that, especially in our political environment, that can be really confusing and cause a lot of, I don't want to call it unnecessary panic, but panic that may not be justified in certain situations. And we want to make sure we provide some clarity around that as well.
Awesome.
So one of the questions, of course, I always hear is, well, can we just keep what we have? And sometimes you can, at least temporarily. But the cost and the structure of that coverage is likely to change more than what you might expect. So instead of just looking for a quick answer, this is more about understanding what your options are, how long do we need those options to last, and then, of course, what are the trade-offs between cost, coverage, and flexibility, all right? And so let's start with COBRA, because this is often the first option that people are going to consider, especially, again, if they're under 65 and they've recently left their employer for whatever reason it might be, whether it is retirement or maybe they've gotten laid off, whatever the case might be. But basically, COBRA allows you to continue your employer health coverage after you leave the job. All right. But here's what is often a surprise to most people. While you're working, you are not paying the full cost of the coverage. Your employer is typically paying some portion of that. Sometimes it's a large portion of that. But once you move to COBRA, that subsidy, that employer provided amount, goes away, and now you're on the hook for the entire amount. And what felt manageable before can quickly become a much larger expense. Sometimes we're talking thousands of dollars per month for the same coverage. And so that's why COBRA should not necessarily be an automatic decision. And in some cases, especially after a layoff, the former employer may cover the cost of COBRA for some period of time, which sounds like a good thing. But there's one big catch, especially when we're talking about retirement, and that is that COBRA is not considered creditable coverage for Medicare enrollment purposes. Okay? So let me explain that in what I hope are very simple terms. I'm sure Wendy, you'll let me know if it's not so simple. But,
yeah, because I'm confused right now.
So for Medicare, once you turn 65 and you're eligible for Medicare, creditable coverage refers to insurance that is considered good enough to allow you to delay enrolling in Medicare without facing penalties later. Okay. So that typically is going to mean active employer coverage from a job that it's either yours or your spouse's. Okay. So if you're still working, as many people are, they continue to work beyond 65. As long as you're with an employer that has typically more than 20 employees and they provide health coverage available to you, you can continue that health coverage without actually enrolling in Medicare. And you're not penalized if you go to, let's say you were going to work to 67. You're not penalized for delaying your enrollment in Medicare. Does that make sense?
Well, that part makes sense. Yeah. I mean, why would they penalize you for putting off? But I guess what I'm thinking is, what if I lose my job at 63 and a half?
That's where this comes in.
Okay.
Because if you say, okay, if I lose my jobs, and we're actually going through a brand new client, he's going through this exact scenario where he's about a year and a half, a little bit less than a year and a half away from Medicare eligibility, was released from his job. Now he's saying, well, can I actually retire? And one of the big questions we have to answer is, well, what do we do about healthcare between now and Medicare eligibility? And the trick is, yes, in his case, he could choose to stay on on COBRA for a period of time.
Mm-hmm.
But the trick is, if you stay on COBRA beyond 65, or if you let's say you even choose for whatever reason to enroll in COBRA after 65, COBRA does not qualify as creditable coverage for Medicare purposes. Meaning that if you just didn't know the rules, let's say it's back to your example of saying, okay, maybe I'm 64 and I can stay on COBRA for 18 months, right? And just because of simplicity, that's what I decide to do. I wait and I say from 64, I start COBRA, 65 and a half, I end my COBRA. Well, in the meantime, you didn't enroll in Medicare. You can actually be penalized a lifetime penalty for not enrolling at the proper time.
So you have to make sure that you enroll exactly when you're supposed to.
Yes, but that's the tricky part is people don't realize that COBRA is not the same as employer coverage for Medicare purposes. So back to my original statement that COBRA is not considered creditable coverage for allowing you to delay your Medicare enrollment.
Okay. I just don't understand why we would want to delay it anyway.
If your employer provided coverage is better than what Medicare can provide,
Yeah.
or
okay.
maybe your employer is paying a significant portion of your premium, that would be a decision. That might be a reason why you would say, well, I don't want to enroll in Medicare at 65 if I'm going to work till 67. I'd rather just keep my employer coverage.
Okay. Yeah, you're right. Didn't consider that. I was just like, why would you not take it? Take it. Take it.
Hey everyone, it's Eric. Hope you're enjoying today's episode. I want to take just a quick moment to share a resource I think you'll find valuable. Have you ever found yourself asking, how much can I put into an IRA this year? Or how much can I earn before my Social Security gets reduced? Those are the kinds of questions that come up all the time, and the answers change often more than you think. That's why we created a free 2-page tax and retirement planning cheat sheet, updated for 2026, with the key tax, Social Security, and retirement numbers all in one place. You can download it right now at the simplyretirementpodcast.com/retirement cheat sheet. It's a simple reference you can keep handy whenever questions come up. Now, back to the episode. If it's available, we often encourage clients to utilize health savings accounts, or HSA accounts.
Yeah.
But if you are going to enroll in Medicare, you have to stop all HSA contributions 6 months prior to your Medicare eligibility.
Okay.
So again, back to the point of saying, well, if I intend to work to 67, I want to maximize my HSA contributions. That is a reason why I would not enroll in Medicare A or B. Because even if you take the free Medicare Part A when you turn 65, that immediately makes you ineligible to make HSA contributions beyond that point.
What is the proper age to file? Is it like 6 months beforehand? Is it at like, a month period? When is the right time?
So in terms of Medicare specifically, if you think about the general enrollment period, so there's different periods based on your specific situation, but in general, the basics are you can enroll as early as 3 months prior to your age 65th birthday. Then the month of is an additional month, and then up to 3 months later. So it's 7 months total. The first 3 months prior to your month of birth, your month of birth month, and then the 3 months after that for a total of 7. That's the general enrollment guidelines.
Okay. I like it.
And so when you're thinking about enrolling, obviously, if you're already retired and you're ready to transition to Medicare, you're all good. But again, as many people are doing these days, continuing to work beyond 65, that's where you need to make an informed, educated decision about, do I really need to enroll in Medicare, or should I enroll in Medicare? If I've got adequate coverage, I've got good coverage, I don't have any issues with that, I plan to work for another couple of years, that would be a reason why you might delay your enrollment in Medicare. But if you say, well, if I lost my job or I retired at 64, I get on the COBRA for the next 18 months, that is not. You would potentially be penalized for late enrollment in Medicare if you just stayed on COBRA for that full 18-month period.
When you don't need to stay on COBRA.
In that case, if that was the circumstances, at 65, you would want to go ahead and enroll. And whether you keep the COBRA, depending on the circumstances, again, sometimes if it's a layoff situation where a company's laying off multiple employees, they might choose to say, well, we'll cover your cost of COBRA for some period of time. That's where it really gets people, is saying, well, if I've got coverage, if they're going to pay for my coverage for the next 12 months, why would I not take advantage of that?
Right.
But for Medicare purposes, that's where the issue pops up.
So if we decide to stay with the COBRA or with our own employer's coverage till 67, I'm assuming we need to fill out some sort of form or something to let Medicare know we're delaying.
So once you get to that point, if you are 67 and you're saying, okay, yep, I'm going to retire, I need to make the transition to Medicare, there would be documentation that they would ask you for to say that, yes, you had continuous coverage from age 65 to age 67. So you can enroll. You're not going to get penalized for enrolling at 67 as long as you can prove that you had creditable coverage. That creditable term is the key phrase.
Okay, so I thought you had to maybe fill out something during the 7-month period that you were going to extend and put it off, but that's not the case.
No, so you don't have to do anything. Now, here's another small caveat that I'll throw out there. If you have started Social Security before 65, you're going to automatically get enrolled in Medicare. And so if you don't want to be, you actually have to decline coverage. You have to go to them and say, hey, I do not want to take my Medicare coverage starting at 65. So that's another thing to be aware of.
Okay.
Right? So let's talk about a little bit more about Medicare. And this is where, again, where the confusion can start is that, if one or both spouses reach age 65, the structure of your health insurance changes completely in that each person now has their own coverage, right? So you have a policy, your husband has a policy, right? That typically is going to include Medicare Part A, Part B, a supplement plan, and a drug plan, or maybe you choose Medicare Advantage where it's all kind of rolled into one plan. And again, one of the biggest surprises is that you're no longer paying just that one premium. You're not having that single premium deducted from your paycheck, or you're not writing a single check for a husband and a wife. Now each spouse pays their own premiums.
Okay.
Now, even though Part A is usually free, as long as you've got enough credits built up, as long as you have enough work history, those other pieces actually can add up because those costs, again, are going to be paid individually. So you pay a separate premium for Medicare Part B, you pay for Part D, or again, if you have a Medicare Advantage plan, you're going to pay for that as well. So now you are paying for something when you're talking about Medicare. And then we get into things like IRMA surcharges, which we've touched on in past episodes, where if your income is too high, you actually might pay an additional premium for Medicare as well.
IRMA says, no, you make too much.
Aunt Irma and Uncle Sam. We want to stay away from those people. You don't want to invite them to your family picnic.
No.
But that's where Medicare, the timing really matters when we're talking about Medicare, because if you're still working and you're covered under an active employer plan, that is generally considered creditable coverage, which would allow you to delay enrolling in certain parts of Medicare without a penalty. But once that employment ends, or if you're relying on COBRA, that protection changes. So again, it becomes very important to understand your enrollment windows and make sure you're transitioning at the right time.
Okay.
Now, from a planning perspective, the shift to individual coverage can actually be helpful because each spouse has their own plan, their own premiums, their own structure. And so again, from the wife's perspective, that can create more clarity, control if she ever needs to manage this whole process on her own. But also we want to make sure we're being intentional about this. So are we choosing plans that are simple to manage? Are we avoiding unnecessary complexity? Because at some point, this does become quite overwhelming, as you can probably expect, right? So let's talk about what if one spouse is not yet 65, or maybe you're single and you plan to retire before 65. This is where, again, can get more complex. So maybe one spouse is moving to Medicare, but the other is not yet eligible. Now you're dealing with, again, two completely different systems at the same time. So the spouse who is not yet 65 will need to explore some of these other options. And again, the first place to look potentially is employer coverage. So you might choose to continue working even part-time just to maintain health insurance through that employer. If that's not an option, the next two things you might think about, again, maybe COBRA. We've already touched on that. But you might also think about Affordable Care Act, or what sometimes is referred to as Obamacare. And this is really where comparing the numbers really becomes important. Because in some situations, COBRA for a single individual may actually be more affordable than an ACA plan, especially if there's no subsidies available. So these tax credits. In other situations, the ACA may offer more long-term flexibility, but this is really where it's okay, let's slow things down a little bit. Let's look at what your specific situation is, because if the wife is not yet eligible for Medicare, she may be the one carrying the most uncertainty in this situation.
Okay.
There's been a lot of conversation about the subsidies, which are essentially just tax credits to help pay a portion of the premium for Affordable Care Act coverage. Because a lot of people think that those subsidies have been completely eliminated, and that's not actually the case. There are still subsidies, there's still tax credits available for lower income individuals. We've essentially returned to where we were pre-pandemic, right? So during and after the pandemic, the income limits were expanded, allowing more individuals to qualify for these tax credits. And those expanded limits have expired. So basically, we're now back to the original guidelines. We're where we were pre-pandemic. So the subsidies are still available, just to a smaller group of people.
Okay. Yeah, you're right. I don't think that is explained very simply at all.
Exactly. Well, I mean, because unfortunately, there's always that political component of one side says this, the other side says that, and they're all wrong, they're all right, whatever it might be. But that's why I wanted to begin, hopefully provide some clarity around what actually is true when it comes to these tax credits. So they are still there. In fact, we have a client right now where we've utilized a plan, we put together a plan that might allow them to utilize these tax credits, even though they have reasonable amount of income, reasonable amount of resources. But that's where planning becomes so critical. Because if you've built an effective retirement income plan, meaning you have income or assets that do not create high taxable income, you may actually still be able to use this strategy to help manage your healthcare expenses before age 65. So just an example, you might be able to draw from after-tax investment accounts or even savings. That may help keep taxable income lower, which could make you eligible for these subsidies that are still there, right? But the key is really that advanced planning. And if you're considering retiring before age 65, what do you do now to plan for healthcare during that window of time?
Okay.
So again, just want to also now provide a simple way to think about your options. So when you step back, obviously this can feel really overwhelming. So I just want to hopefully simplify this. So when you're evaluating your options, it can help to think about it in this general order. First, Medicare if you're eligible. Second, look at your employer coverage if it's available. Third, COBRA as potentially a short-term bridge. Fourth, ACA coverage as a potential alternative. And lastly, there are also individual policies that are out there. They're not talked about as much because they're, from a political perspective, they're not quite as polarizing. But there are also just basic individual policies out there that might make sense for certain people as well. Again, this is not a strict rule, just simply a framework to hopefully help you organize your thinking as you're evaluating your options. And again, across all these options, I want to come back to this planning lens in that we're not just choosing what works as a couple today. We also want to make sure that we're choosing what's going to work for each person individually, especially the wife, if she ever has to navigate this on her own, which again, potentially at some point she may. And that's really how we actually want to reduce risk and how we can make better long-term decisions.
Got it.
So I know we hit a lot of these different areas as far as healthcare. Hopefully there's, again, some level of a process to help evaluate your options. Anything else that you feel like I should add or clarifications on any of the strategies or concepts that we talked about?
No, I'm just going to ask my financial advisor what I need to do.
That's a good thing to do. Make sure your financial advisor understands what's going on.
Yes, exactly.
So as we wrap up today, here are a few key points I want you to keep in mind. Health insurance decisions often change significantly when you leave your job, obviously. What used to be one family plan may become two separate decisions. COBRA can be helpful, but it is not always the best long-term option due to cost and timing considerations. Medicare introduces individual choices and separate premiums for each person. And when one spouse is not eligible for Medicare, it becomes even more important to carefully compare all the options that may be available. This is not about finding the perfect answer. Again, it's just about understanding your options and making an informed decision about your healthcare options.
Okay.
All right. So hopefully we got through that. Hopefully that again provide a little bit of clarity. As always, thank you for tuning in. Thank you, Wendy, once again for joining me. If today's conversation raised questions for you, I definitely would encourage you to start by downloading our free checklist that I talked about at the beginning of the episode. Will healthcare change as I transition into retirement? It is designed to walk you step by step through the same framework we use in our planning conversations. And if you're looking for a personalized retirement plan that helps you make smart decisions around income, investments, taxes, and healthcare decisions, you can visit getmysimplyretirementroadmap.com to schedule a call with our team. That's it for today's episode. Again, for all the links and resources mentioned today, you can visit the simplyretirementpodcast.com. Don't forget to like, follow, and share our show. And until next time, please remember, retirement is not the end of the road. It's the start of a new journey.
That's it for today's episode of the Simply Retirement Podcast. We hope you found our insights and advice helpful in planning for a fulfilling retirement. Don't forget to take action on what you've learned today. Visit our website at blakewealthmanagement.com to learn more about our firm and review our Simply Retirement Roadmap process to get you on the right path to the retirement you deserve. And don't forget to click the follow button to be notified when new episodes become available. Thank you for joining us on this journey, and we look forward to helping you achieve your retirement goals. Remember, retirement is not the end of the road. It is the start of a new journey. So embrace it and make the most of it. Until next time, take care. Content here is for illustrative purposes and general information only. It is not legal, tax, or individualized financial advice, nor is it a recommendation to buy, sell, or hold any specific security, or engage in any specific trading strategy. Results will vary. Past performance is no indication of future results or success. Market conditions change continuously. This commentary reflects the personal opinions, viewpoints, and analyses of Blake Wealth Management. It does not necessarily represent those of RFG Advisory, their clients, or their employees. This commentary should not be regarded as a description of advisory services provided by Blake Wealth Management or RFG Advisory, or performance returns of any client. The views reflected in the commentary are subject to change at any time without notice. Advisory services offered by investment advisory representatives of RFG Advisory, a registered investment advisor, Blake Wealth Management, and RFG Advisory are unaffiliated entities. Advisory services are only offered to clients or prospective clients where RFG Advisory and its representatives are properly licensed or exempt from licensure. No advisory services may be rendered by RFG Advisory unless a client agreement is in place.